Hi, and welcome to the Ask Dr. Angela show with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been just too embarrassed or shy to ask your own doctor a question about your, private stuff? Well, you have come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. OBGYN, she keeps it real. Pregnancy, she knows what you're expecting. Whole body health, just ask. Dr. Angela has you covered, girl. And now here is Dr. Angela.
What's good, people? This is Dr. Angela, everyone's self-proclaimed favorite OBGYN, and I would like to welcome you to episode 15 of the Ask Dr. Angela podcast. So I'm always fielding these questions from you all, from all over the world, and I'm super excited about that. But I was seeing patients in the office today, and I thought to myself, I've got a question that I would like to pose to you all. Granted, you all know that, again, I'm an OBGYN and I see women exclusively, and one of the task that I am oftentimes presented with conquering is some kind of rescue of a foreign object, whether it be a condom, a tampon, etc. And so one of the things that I oftentimes wonder is, why are patients, women in particular, afraid of their own vaginas? I'm like, why are women so afraid to even look at their own vaginas or even touch their own vaginas? I mean, it's not like the vagina is some never-ending tube. And so, I would challenge you, to reach up there and try to grab whatever it is that's there, whether it's a retained tampon or, in my most recent case, it was a retained condom. And I'm like, tell your partner to reach up there. It's not like they're a stranger to that part of you, right? Anyway, let's move on to our question coming to us from Shimmy, Gainesville, Florida. What's up, Shimmy? What do you have for us today?
Hello, Dr. Angela. This is Shimmy calling from Gainesville, Florida, and I have a question about inverted nipples. My right nipple is inverted, and I can pull it out, but it's just always inverted. It used to be a source of great embarrassment for me. Now that I'm older and I'm in an established relationship and I have a partner who doesn't care, it's no longer an issue. But I was just wondering, is that a sign that there's something wrong? Should I be concerned about that? Looking forward to hearing your answer. Thanks, Dr. Angela. Keep up the great work.
Shimmy, thank you so much for asking this question. This is actually a fantastic question. And no, girlfriend, you are not some freak of nature. Actually, 10 to 20% of people have inverted nipples. And because you've had this, what sounds like for your entire life, this is even more reassuring. So don't be embarrassed. Don't feel weird. As you, I'm sure, can probably attest, you have just as much sensitivity and pleasure, that you get from your inverted nipple as you do from your other nipple. The only thing about inverted nipples that might raise my eyebrow or furrow my brow even, might be if you said to me, Dr. Angela, my nipples used to be fine, and now they're all of a sudden inverted, just out of the blue. They went from being outies to innies. That raises my eyebrows just a little bit. And if that were to happen to any of you out there, I definitely would recommend following up with your healthcare provider, because that might be a sign of something more significant going on, i.e. the big C, cancer, Paget's disease, etc. So Shimmy, your partner's good with it. I'm good with it. You should be good with it. Thank you so much for asking. And because you took time out of what I know is a crazy schedule, someone from my team is going to be reaching out to you so that we can gather your information and send you one of our bomb-ass t-shirts. For those of you who are listening who would like to submit a question to the Ask Dr. Angela podcast, please visit us at askdrangela.com. That's AskDrAngela.com. Click on the microphone on the side of the page and then do what you do. In closing, I'd like to leave you with this. Look at what you've got and make the best of it. It is better to light a candle than to curse the darkness. Until next time, people, look better, feel better, be better. I can't wait to see you for episode 16.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon. All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any diseases or illnesses and does not and should not replace treatment for a medical professional. Listening to and participating in this podcast does not create a doctor-patient relationship between you and Dr. Angela Jones. If you need medical advice or assistance, you should consult a physician. Listening to and participating in this podcast is subject to the terms and conditions posted at drangela.com/terms.